older drivers in general are a little bit higher risk for injury, certainly when driving motor vehicle crash is involved because of a lot of changes that are just inherent to the aging process. Decreased eyesight, decreased reaction times, sometimes their strength in their arms or legs, any of that sort of thing can sometimes inhibit their ability to react to unexpected situations. And you have a lot of things like medications or health problems that will tend to rear their head in older years that can also play a role.
The commonest thing that everyone knows about is one of the different diseases that can cause dementia. Obviously, Alzheimer's disease is an example of that. There are several diseases, though, that can cause dementia, but they all end up affecting memory and cognition and the ability to reason things through.
And sometimes it's things as simple as increasing arthritis, where it's not necessarily affecting a person's cognition, but it's affecting their ability to turn quickly, to brake quickly, and even the fine motor skills that are sometimes needed to be able to make adjustments quickly when there's other drivers that maybe aren't driving as safely. Even that kind of reactive and that protective driving skill can be lost a little bit with that too.
The other thing to mention is medications that get used to treat many conditions. Any of a wide variety of medicines potentially can be risky for driving.
Medications that older drivers are often sensitive to include pain medications, sleep medications, medications for depression or mood, allergy medications, as well as blood pressure medications and medications that we often use to treat enlarged prostate.
Vision potentially could be deteriorating. Cataracts are not a part of normal aging, but they become fairly common in older adults.
Usually, the earliest signs of trouble with driving is nighttime driving. You'll get glare around lights, you might get halos around lights or starbursts that come off of lights. Sometimes in office buildings, the fluorescent lighting makes your vision blurry because you're getting some eye diseases. But vision is a key reason to have your driver's license limited.
So when older drivers are injured, I wouldn't say that there's necessarily an injury that's more common in that population. They are susceptible to the same things that younger drivers are. I think the bigger issue with elder drivers is that their recovery from those injuries and certainly the seriousness with which their livelihood and their well-being is affected by those injuries is much more pronounced. Getting that risk mitigated in any way that we can is certainly a benefit to the population and a benefit to those patients in particular.
I think anytime an older adult or a family member has concerns about driving, it's time to bring that up to the physician or other specialists who can provide some guidance about whether driving remains safe or whether there are other things that a person can do that will make driving safer.
It's not always a black and white answer of can you drive or should you not drive. A lot of times it's, well, what can we do to make things different or make adaptations to make it a little bit safer for you. So that may include being able to drive during the daylight hours, really avoiding early morning or nighttime hours. Also really avoiding high traffic times. If you can really not try to hit it at the rush hour, traffic is much easier for someone to navigate if they're starting to have some minor impairments. Other things to keep in mind is if there's a familiar route that they're comfortable with. Oftentimes those are usually the safest routes to take.
So I think the driving retirement programs that we've talked about with our institution and with many others around the state of Missouri is an excellent way to try and get older drivers to at least consider the alternatives.